Bismillah, Alhamdulillah, wassalatu wassalamu ala Rasulillah, Rabbi shrah li sadri wa yassir li amri, wahlul uqdatan min lisani, yafqahu qawli. Assalamu alaikum wa rahmatullahi wa barakatuh. I want to talk about a problem that I'm very passionate about, and that is the issue of cannabis and marijuana. Unfortunately, it seems there is a big push to legalize cannabis worldwide, and we already know that across a lot of the states in the US. It's already been legalized in Canada, obviously in Holland, and there seems to be an influence and a push and an agenda to legalize it in Muslim countries. Some of the best hashish is grown in Morocco. So I want to talk about this issue because I think we need to educate people about the dangers of using cannabis, and obviously from an Islamic perspective, it's haram anyway because it's an intoxicant. But I don't know, but I'm increasingly seeing Muslims kind of minimizing and trying to justify that it's okay to smoke weed or cannabis or marijuana. They have different names, obviously. So I'm going to give you some scientific data to support what I'm saying. Now, there's another issue in terms of what the people are calling medical marijuana to treat pain, cancer patients, etc. And it's too early to really make a judgment on that. Um, but I'm speaking about kind of recreational use of cannabis, which is a problem amongst young people and even adults worldwide, and especially also Muslims. So, what is cannabis use disorder? So, when I talk about disorders, I usually refer to two diagnostic systems that we use in mental health. One is the DSM-5, the Diagnostic and Statistical Manual, which is produced by the American Psychiatric Association. And then we have also the ICD-10, which is produced by the World Health Organization. So cannabis use disorder, and I'm going to just, as a disclaimer, interchangeably use cannabis, weed, marijuana, hashish, okay? So it's a substance use disorder that is characterized by problematic patterns of cannabis use leading to clinically significant impairment or distress. So basically what that means is that um, some people use marijuana despite, it causing health and social problems in their lives. Okay. So in terms of like epidemiology, there's a lot. It's the most commonly used substance along with alcohol and tobacco by young people worldwide. About 1 in 7 Canadians aged 15 and over report using cannabis per year. And based on the DSM-5, the 12-month prevalence of cannabis use disorder in the US is about 3.4% among 12 to 17-year-olds and 1.5% among adults. In the past decade, due to this perception of low risk of cannabis use and legalization worldwide, the prevalence has increased in both adults and adolescents, which is a public health concern. Cannabis use disorder is greater in adults, males 2.2% than females, which is 0.8%. And the onset is most commonly during adolescence or young adulthood. Now, in terms of prognosis, very early use of cannabis, usually under the age of 15, is a reliable predictor for the development of cannabis use disorder, okay, and other substance use disorders and mental disorders, for example, psychosis and schizophrenia. I'm going to talk about that, inshallah. For adolescents and young adults, school difficulties are commonly in cannabis use disorder. There can be a dramatic drop in academic performance and grades, truancy, reduced interest in school activities, conduct problems, and social problems. Generally, tolerance is lost when cannabis use is stopped for at least several months, and chronic cannabis use is linked to a reduction in pro-social goal-directed activities, also called amotivational syndrome, which can cause poor school and or employment performance. Accidents whilst you're during cannabis intoxication, such as driving, are also a risk for safety. And despite public perception of this low risk, which is what I'm talking about, smoking and inhalation of cannabis can still deliver high levels of carcinogenic compounds, so compounds that cause cancer, that also increase the risk for respiratory disease, similar to tobacco smokers. And the risk for cannabis use in psychosis and the onset of schizophrenia is something that is continuing to be studied. And there's a number of studies, you can do your own research, which shows a clear correlation and in some studies, a causal link between smoking cannabis and developing a psychotic illness like schizophrenia. SubhanAllah, I read one study which showed that if people are smoking more than, I think, 5 joints daily, compared to those who are not smoking, they're at least 10 times at a higher risk of developing mental health problems, particularly a psychotic illness where they lose sense of reality, um, and schizophrenia also. Now, in terms of other mental health illnesses that co-occur with people who abuse cannabis, so those who use regularly cannabis may have mood, sleep, pain, and other physical mental health symptoms. And as I said, there's also an increased risk of co-occurring mental disorders. There is more often than not another comorbid substance use disorder. So people who are using cannabis will also usually have other addictions, like with alcohol, with crystal meth, maybe opioids as well. There are high rates of alcohol use disorder and tobacco use disorder, both more than 50%. So those people who are using cannabis are also at higher risk of developing alcohol problems and tobacco nicotine addiction. Other increased substance use disorders like stimulants, cocaine, methamphetamine, and opioids. Major depressive disorder, 11%, anxiety disorder, 24%, and bipolar disorder, 13% are very common. Antisocial, 30%, obsessive compulsive, 19%, paranoid, 18%, personality disorders are common. So personality disorders are also very common in people who are using cannabis. What about risk factors? Well, conduct disorder and antisocial personality disorder are risk factors for developing substance use disorders. Psychiatric disorders, both externalizing and internalizing, are also risk factors. Unstable or abusive family environments, use of cannabis in other family members, a family history of substance use disorders, increased ease of access, low socioeconomic status are all risk factors. Heritable factors are thought to contribute to between 30 to 80% of the total variance in risk for cannabis use disorder. Like I mentioned earlier, there are a variety of names for cannabis or cannabis-like substances like pot, weed, herb, reefer, Mary Jane, dagga, dope, bang, skunk, boom, gangster, kif, ganga. And there's also now, unfortunately, synthetic cannabinoids, um, which are also being abused. How does cannabis work? Well, cannabis basically consists of two primary constituents. You've got THC, which is 9 tetrahydrocannabinol, and cannabidiol, CBD. So THC is the principal psychoactive constituent of cannabis. And if you contrast this with CBD, which is not intoxicating and does not have the same psychoactivity as THC, but CBD may play a role in the treatment of psychiatric and neurological disorders and is under investigation, like I mentioned. Cannabinoids have many effects in the brain, and its main actions are on the CB1 and CB2 cannabinoid receptors in the central nervous system. The brain also produces its own endogenous ligands for these receptors, which act similar to neurotransmitters. So, what about the criteria, DSM-5 criteria for substance use disorder relating to cannabis? Okay, so criteria A problematic pattern of cannabis use leading to clinically significant impairment or distress as manifested by at least two of the following occurring within a 12-month period. Number one, cannabis is often taken in larger amounts or over a longer period than was intended. Number two, there was a persistent desire or unsuccessful efforts to cut down or control cannabis use. Three, a great deal of time is spent in activities necessary to obtain cannabis, use cannabis, or recover from its effects. Four, craving or a strong desire to urge to use cannabis. Five, recurrent cannabis use resulting in a failure to fulfill major obligations at work, school, or home. Six, continued cannabis use despite having persistent or recurrent social or interpersonal problems caused or exacerbated by the effects of cannabis. Seven, important social, occupational, and recreational activities are given up or reduced because of cannabis use. Eight, recurrent cannabis use in situations in which it is physically hazardous. Nine, cannabis use is continued despite knowledge of having a persistent or recurrent physical or psychological problem that is likely to have been caused or exacerbated by cannabis. Okay, and 10, tolerance, which is defined as either of the following: a need for markedly increased amounts of cannabis to achieve intoxication or desired effect; B, significantly diminished effect with continued use of the same amount of cannabis. 11, withdrawal, which is manifested as by either of the following: A, the characteristic withdrawal syndrome of cannabis, and then B, cannabis is taken to relieve or avoid withdrawal symptoms. Okay. Now, in terms of other data that we know, cannabis is most commonly smoked using pipes, water pipes, bongs, hookahs, cigarettes, rolled paper, or through oral edibles. And developments in vaporizing technology has also led to increased use via vapes or inhalation, which produces a more rapid onset and intense effect. And during the past 2 decades, the potency of THC specifically of cannabis has been gradually increasing, and the potency of THC ranges greatly from 1 to 15% in typical cannabis plant material up to 10 to 20% in hashish. Oral formulations also of delta 9 tetrahydrocannabinol, delta 9 THC are prescribed for a number of medical indications like nausea and vomiting caused by chemotherapy, anorexia, and weight loss in AIDS. So, what about the link between cannabis and psychosis, which I mentioned? Well, the data shows there's an increasing evidence to suggest a link between people who smoke cannabis and its effect on accelerating the onset of schizophrenia in vulnerable individuals. This is especially true with cannabis use during puberty. So, this is really important to educate our young people not to use cannabis because um, there's a particularly higher risk of developing schizophrenia or psychotic symptoms. Whether it is a true cause and effect remains under investigation, but recent population studies have shown that almost 50% of individuals with an episode of cannabis-induced psychosis will go on to develop schizophrenia or bipolar disorder. So just let that sink in. So people who have a psychotic illness induced by cannabis, 50% will go on to develop schizophrenia and bipolar disorder, which is a chronic kind of life limiting, life diminishing disorders. So it's problematic to say the least. We usually test using urine drug screens. So we test for cannabinoid metabolites, which can determine recent cannabis use. And since cannabinoids are fat soluble, they can remain in the body fluids for extended periods of time and are excreted slowly. Right. Okay. There are no approved pharmacological treatments for cannabis disorder. The main treatment remains psychosocial management, use of psychotherapy such as motivational interviewing, cognitive behavioral therapy, mindfulness-based relapse prevention, and contingency management. Okay, so that's some of the data. Now, the CDC, which is the Center of Disease Control, um, has shown that a study estimated that approximately 3 in 10 people, 30%, who use marijuana have cannabis use disorder. Another study estimated that people who use cannabis have about a 10% likelihood of becoming addicted, and the risk of developing marijuana use disorder is greater in people who start using marijuana during youth or adolescence and who use marijuana more frequently. Okay, so it is the most commonly used federally illegal drug in the legal drug in the US. 48.2 million people, or about 18% of Americans, used it at least once in 2019. Recent research estimated that 3 in 10 people who use marijuana will develop this marijuana use disorder. And for those who begin using or smoking cannabis before the age of 18, the risk is even higher. Marijuana use directly affects the brain, specifically the parts of the brain responsible for memory, learning, attention, decision making, coordination, emotion, and reaction time. Infants, children, and teens whose brains are still developing are especially susceptible to the adverse effects of marijuana. Long-term or frequent marijuana use has been linked to increased risk of psychosis, schizophrenia, as I mentioned. Um, and using marijuana during pregnancy increases the risk of pregnancy complications. So women who are pregnant and breastfeeding need to avoid uh, cannabis. Um, so this is some of the data research that's kind of well established. And I just want to emphasize that please educate our youth, your children, about the risks of cannabis use. Like I mentioned, there are external forces, agendas, which are pushing for the legalization of cannabis, and unfortunately, many young people, as young as 8, 9, I'm in my clinical practice, Muslim patients are using cannabis. And there seems to be this societal, cultural kind of acceptance that it's not a major issue. Unfortunately, like I mentioned at the beginning, it's haram. Um, and there are clear kind of mental health, physical health issues that are associated with it. So we really need to push back and educate our communities about the risks of marijuana use, cannabis use, smoking weed, and use prevention programs. Community leaders need to get engaged with the youth because substance use is really, subhanAllah, affecting the Muslim community significantly. The other aspect to also tackle is gangs in terms of drug dealing, and because there's a lot of money involved, not just with cannabis, but opioids, crystal meth, ecstasy, cocaine. And unfortunately, many Muslims are involved in this activity. So they're destroying, subhanAllah, families because of dealing drugs and causing significant problems, also affecting their own akhirah. Inshallah, I hope that was beneficial and useful. As I mentioned, I'm a strong advocate for mental health and mental well-being and wellness, and we really need to tackle these kind of issues head on, proactively and creatively. Until next time, this is your brother, Dr. Abu Isa. Assalamu alaikum wa rahmatullahi wa barakatuh.